Vanakkam, good morning. In this video, we are going to discuss about the Korotkoff sound. Korotkoff sounds first demonstrated by the Russian physician Nikolai Korotkoff in 1905. The Korotkoff sound is demonstrated during the auscultatory method of the blood pressure measurements. So in the auscultatory method, we are keeping the stethoscope. We can hear the Korotkoff sound by the stethoscope. This is the Riva Rossi cuff. We are tied above the elbow, just above the elbow. So when we are raising the blood pressure above the systolic blood pressure, the Korotkoff sound is not heard. So in between the systolic and diastolic blood pressure, we can hear the Korotkoff sound. So the normal blood flow is the laminar blood flow. So it is the soundless blood flow. In between the systolic and diastolic blood pressure, the blood flow is changed into the turbulent flow. So it produces the sound. That sound is Korotkoff sound. This is first demonstrated by the Nikolai Korotkoff in the 1905. So Nikolai Korotkoff sounds has the 4 phases. First phase is the sound is tapping sound. So from the 120 millimeter mercury to 110 millimeter mercury. For the normal person, it is tapping sound. Another from the 110 millimeter mercury to 100 millimeter mercury, it is murmurous sounds. From the 100 to 85 millimeter mercury, it is loud sound. And from the 85 to 80, it is muffling sound. It is 5 millimeter mercury. Then sound is disappear. So this is the different phases of the Korotkoff sounds. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed to this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.